G'day, my name's Lydia Maney. I am a registered nurse and I'm the head of course of the Graduate Certificate in Nursing Re-Entry and International Entry at CQ University, Australia. Today, I'm going to have a chat. It's going to be no frills. It's going to be pragmatic about delegation to student nurses. And when I say student nurses, I don't just mean my guys, the re-entry and international entry crew. I mean any undergraduate nursing student, any enrolled nursing student, and if you delegate to student AINs, those guys as well. I'm going to be using the decision-making framework, which was put out by the Nursing and Midwifery Board of Australia earlier this year, as well as the laws and guidelines that underpin it. All right, so before we really get into the 4 different layers of the decision-making framework, I want to just refresh you about the legalities and the types of delegation. So on the legal side, you probably already know this. When you accept handover from one RN about a patient or a group of patients, you are accepting legal accountability for the care provided to those people until you hand over to another registered nurse. And that usually happens when you're going on your lunch break or at the end of a shift. Next, the people that you delegate to are legally accountable and responsible for the level of care that they provide. So if you in good faith delegate to somebody who then goes and does a bad job, that's not on you. But if you delegate the wrong thing to the wrong person, then you are legally accountable for that. But there's a little bit more to it, which I'll get to later on. Next, there's 2 types of delegation, transferal and conferral. We'll talk about transferal first because that's probably what you do the most of. Transferal is when you're transferring your accountability to carry out an activity from the nursing care plan to somebody who is already confident and competent and authorised by the facility to carry out that task or activity as part of their normal job. The job thing is the clincher there. So this commonly occurs between, say, for example, the registered nurse and the enrolled nurse, or the registered nurse and the AIN. They're already employed at the facility. Conferral occurs when you transfer authority to somebody who is confident and competent. They always have to be confident and competent, but they don't have the independent authority to carry out the task. And this usually happens in 2 situations. One, it's an emergency and you have to delegate a task or activity to somebody who might be confident and competent to do it at the private hospital, but they haven't done the learning package yet at the place where you work. But you have to get somebody to do it. I'm thinking of IV cannulation, for example. They've done the cannulation course at the Mater Hospital, but they haven't done it at the public hospital. It's an emergency. The patient requires cannulation. You're busy maintaining an airway. You directly supervise them, and the registered nurse or the EN who's doing the cannulation understands that it is just in this situation that they have the authority to undertake this task and activity. More commonly, though, conferral happens between the registered nurse and the student nurse. The student nurse isn't an employee, they're not registered, and they don't have independent authority to do any task or any activity in the hospital. So conferral happens for a limited amount of time. And that's usually, say, for example, if it's an invasive procedure, it's for one person at one moment, and you titrate the level of supervision depending on how invasive or dangerous or risky the activity is. But it's usually just at one time. Or you say, for this shift, you are doing the vital signs or I don't know, measuring the urine output for this patient. It doesn't apply to all the patients unless you have those one-on-one conversations and put the time limitations around it with that student. Hand on heart, I can say that I absolutely didn't do this. I had no idea about the difference. So now that you know, let's get into the decision-making framework. Like I said before, there are 4 elements to the decision-making framework. Each of those main elements has a couple of steps that fall underneath. It is an algorithm, so if the first element is not met, you cannot proceed to the next element ad nauseum. So there have been previous versions which looked really, really complex. The new version that's been put out this year is a lot more straightforward. So when you're deciding to delegate, the very first step at the top is you need to define benefit to your delegation. The delegation always has to be made in the patient's best interest. That's a no-brainer. But just say that you need thinking about delegating to a student because it'll save you some time. Saving time alone isn't a reason why you would delegate to a student. If it was in the patient's best interest because you wouldn't be able to get to them for another couple of hours, then that would be a justifiable reason why you would delegate. So you've got to identify the need. But before you can identify the need or delegate anything to anyone, whether it's a student, an EN, or an AIN, you need to do a comprehensive health assessment of the patient. I have definitely supervised students where I have asked them to go and do the observations on patients at the beginning of the shift and report back to me. No, that's not what we're supposed to do. And the reason is that we're accountable for delegating, so we have to know the health status of the patients before we delegate anything. We have to know it ourselves. We can't go off the handover report. Things can change. We all know that. So what does a comprehensive health assessment look like? Do you need to go and slog it out and get around everyone before you do anything? Well, if you're in a team nursing situation, no, you don't. And it's a really good opportunity for you all to knuckle in with each patient and you directly supervise the team doing elements of the comprehensive healthcare assessment. And at the same time, you're assessing them, all of them, including the student, to see how you're going to be delegating for the shift. So you might get the enrolled nurse to review the medications. If you're thinking about delegating that to him or her for the shift, you might get the student to be doing the vital signs. You might get the AIN to sit the person on the side of the bed or to consider their mobility and strength. You can be the director, is what I'm saying. And then after you decide that there's an identified need, you need to gain consent from the patient. Are they happy for a student to be involved in their care for the day, or an AIN or an EN? Next, we move down to number 2, which is this within the nurse's scope of practice? And when I say nurse, I mean all the nurses that I've mentioned before. So the nursing scope of practice is so broad, and I promise I'll do another little YouTube video on scope of practice, particularly around why is a first-year nurse's scope of practice from this university so different from the first-year nurse's scope of practice from that university. That is a whole other soapbox that I need to stand on, but that's not for today. So you've got to talk to the student about, is this in your scope of practice? They might have a sheet that they come with that says, I can do these activities and I actually need to tick off these activities for the day because I've done them in the lab, but I've never done them on my guys will never come with a list. The reason they don't come with a list is because they have such varied background that I could not capture in a list all the different activities that they could do. And just because John can do these activities doesn't mean that Mary can do those activities. They have the generalities taught to them in our 40-hour lab, but the different little bits and pieces that they come with beforehand are very unique to each student. So you need to have a conversation, any student really, about is this within your scope of practice? Have you done it before? How long is it since you've done it? Next thing you need to know is, actually, does my hospital support the student in doing the activity? Well, the best way is to get the student to have a look at the policies of the hospital and then share with you whether they can or can't do the procedure. Sometimes hospitals don't stipulate if a student can do the activity, and then you have to continue working down the framework and think critically about, well, can they do it? So if there's no guidance, it's a discussion for you to have with the nurse unit manager, or if you both don't know, it's the two of you working through the decision-making framework, and it's usually around risk and patient benefit. So number 3 is consider the context, the governance, and any risks around the activity that you want to delegate. So context is usually the ward context. Is it so busy that you cannot provide the student with the type of supervision that they need when you're delegating to them? If it's yes, it is so busy that I cannot give this student the support that they might require, don't delegate. This often happens when it is so disgustingly busy that you want to use the student nurse as an additional set of hands to help you with a really ugly shift, or if the student goes off on their own bat, which does happen because they think that they're doing the right thing. They think that they're showing initiative and they go and do stuff, but you don't have the time to help them out if they get stuck, which can make a bad situation much, much worse. So better off that the student directly observes you or is directly working with you when it's disgustingly busy, than you delegate stuff to them which you can't help them out with if something goes wrong. Next, have you identified any risks? There's always risks. And have you got strategies to minimize those risks? So a couple that I can think of here is, have you seen the student perform the activity before? No? Well, then directly supervise them the first time, setting them up so that you can indirectly supervise them from then on. Risk minimization strategy that I now use is to get the student to come back and report to me. All right, now moving down to the last element. Element 4 is, are we selecting the right person to do the right job? Now, I missed something really important in scope of practice on purpose, and I'm bringing it down to this section. You cannot delegate anything from the nursing care plan that you are not confident and competent in doing yourself. Because when you delegate, you are responsible for supervision, education, training, debriefing with the person about the task. So if you don't know how to do the task, you definitely can't supervise to know if they're doing it correctly or not, and you can't provide education and debrief about it adequately either. So what do you do then? Well, you need to go talk to another registered nurse, and then they would need to have some sort of handover on the patient, and they can delegate that task. Okay, so it's come time to select the most appropriate person in the team to delegate to. You've got a couple of ideas, but you've still got some steps to go. Number 1, have you considered the scope of the person that you're going to delegate to? Number 2, does that person have enough education and training already? Will they require further support when you're delegating? Do you have the time to provide that support? Next, do they feel confident and competent to perform the procedure. Now, does the student know that they have to perform the task to the same level as a registered nurse? Do they understand that you've delegated it to them, and if they don't perform the task, then they're accountable for that? Do they understand that if they don't know what they're doing or they feel unsure, that they need to come back to you and ask for assistance? And finally, is the level of supervision, support, or education required available? And if yes, continue on and you can delegate. So the big things for you to think about now when you're next delegating to students are, number one, understand that when you delegate, that you're only doing it for a specific amount of time and in a specific context with that student. Two, that you have to do a comprehensive patient assessment before you delegate anything from the nursing care plan. Number three, scopes of practice are different for every nurse. We cannot guess what a student can do. We cannot guess what our colleagues can do either. So having a chat with them before you start the shift, when you first meet each other, and as you are doing your delegations each day, will demystify the situation substantially for you. I hope I haven't scared you. I hope it's been interesting, and I hope it's really got you started thinking about delegation and supervision of student nurses. If you've enjoyed this video, please give me a like, and in the chat below, feel free to suggest other topics that you might need demystifying with students. Okay, I hope you have a good shift.